chemotherapy, targeted therapy, immunotherapy, and hormonal therapy. Dr. Shah has been at the forefront of delivering high-quality cancer care, especially in addressing the complexity of advanced cancers. This session is designed to provide valuable insights into cancer care, cancer prevention through early detection, healthy lifestyle choices, and awareness initiatives. If you have any questions, you can add in the chat box and we can address the same after the session is completed. So without further ado, please join me in welcoming Dr. Rushit Shah. Dr. Shah, over to you, sir.
Thank you so much. Yeah, thank you so much, Dr. Udri, for the kind introduction and a warm welcome to everyone. Thank you so much, Kedila, for providing this opportunity for me. And today, on the day of World Cancer Day, we will discuss something more about cancer, a basic about cancer, how we can avoid having a cancer, what precautions we can take, and what symptoms cancer does have, and what are the treatment modalities as a cancer physician we offer to our patients. And as you said, the unique theme of this World Cancer Day is United by Unique, which reinforces the personalized treatment. And when each patient is unique and each cancer is unique, so we have to decide the treatment for each and every patient differently.
Let's just begin with the understanding of the key challenges in the cancer care, and if you can share your thoughts on importance of the early detection to begin with.
Right. So usually challenges with the diagnosis of cancer, it begins with the diagnosis of cancer. So when patient comes to us, so usually in India currently also most of the cancer, or I would say majority of cancer, they are diagnosed in very quite late stage, and some cancer are there which can be picked up at very early stage, like cervical cancer, even oral cavity cancer, जो कि buccal mucosa and involving tongue, those cancers, even breast cancers, they can be picked up quite early. But in our scenario, what we see is the patient presents with at least in a third stage or sometimes even in a fourth stage. So that is the biggest challenges that we have in our country at present.
Right. So generally, that was very helpful, and many people may experience some symptoms at earlier stages. So they can, it is very important to differentiate from the common ailment and what can be the signs for the cancer. So if you can elaborate more on that, what could be the early sign and how one can differentiate from the normal or common ailment and the early signs of the cancers that may be helpful for our products.
Right. So there are actually many sign and symptoms which overlaps with the routine or conditions or benign conditions, like simple fever or somewhat weight loss or chronic cough. But there are certain red flag signs that we advise a patient to look for or normal people to look for. And if such red flag signs are there, then they should go to their family physician. That is most important. So some of the signs or symptoms can be, say, a long-standing ulcer anywhere in the body, commonly in the oral cavity, which is not healing, which is bleeding, some new lump in any part of the body, then unexpected weight loss or unexplained weight loss that is more than 10% in 3 to 6 months. So that is again concerning why this much weight should one loss. Then chronic cough, which is not resolving since say 1 to 2 months. There are some other symptoms also like change in the bowel habits, chronic constipation or constipation alternating with diarrhea, having blood in stool. These are all can be symptoms of intestinal or bowel cancer. Sometimes difficulty in swallowing food, That can be a symptom of a esophageal cancer. Change in voice can be a symptom of laryngeal cancer. So broadly, I would say anything unusual in the body which lasts for 3 to 4 weeks, one should be alert.
That was very helpful. So, as you rightly said, that early detection can make a huge difference in early diagnosis. So, at what point should someone consult a doctor? Because many a times there is hesitancy from the patient side to visit a doctor. So, at what point one should consult a doctor?
Yeah, all those symptoms which I mentioned require a consultation with a doctor. Uh, Many a times it cannot be a cancer physician or cancer surgeon, but they should at least contact their family physician so that he can evaluate and he can judge how serious these symptoms are or how alarming these symptoms are. And based on this history and even physical examination, your family physician can advise you further investigation. And if some findings are there, there are some obvious signs, then he may refer to cancer physician. So most important to consult first your family physician in this scenarios.
Right. And many of the cancers have established screening tests as well. So, what are those tests, and at what age and frequency should individual get them tested, or what is the time for the individual to get them screened?
Right. So there are some cancers, as you said, that can be detected very early in a precancerous stage also. And if not precancerous, then very early cancerous stage by this screening method that can be detected. Examples are breast cancer and cervix cancer. So both of these cancers are very much early detectable and they are amenable to screening. So first I'll talk about breast cancer. So because it is the most common cancer in the world and now in India also it is the most common cancer overall. So for breast cancer, the guidelines says that every woman after the age of 40 should undergo a yearly mammosonography. So a mammography, for the audience, I would like to elaborate it that the mammography is basically an X-ray of both breasts, and along with the X-ray, we also do a sonography that screens the breast and the axilla part, the armpit part. So that has to be done every year, and by doing a simple mammography or simple X-ray of the breast and axilla, we can screen the cancer in very early stage. So that is the best example. And we know that whenever a cancer is detected in early stage, the chances of cure are maximum. The number of modalities which needs to be used, say it can be cured with surgery sometimes. Even no radiation or chemotherapy is required when we are in early stage. So that is the benefit of screening. Second cancer is a cervical cancer. So cervical cancer is cervix is the basically lowermost part of the uterus, and the cervical cancer is also one of the common cancer. Fortunately, in India also the incidence has quite reduced in last 10 to 15 years, thanks to the good government screening program and better hygiene. So, but this cancer is the causative agent is actually human papilloma virus, that is HPV, and it is detected in more than 95% of patients with cervical cancer. So, in cervical cancer is the cancer which can be detected even before the development. The precancerous stage can be detected by doing a pap smear. So, they take a scraping from the cervix and they do microbiology laboratory and human papilloma virus testing also on that sample. And then woman can be into high risk or low risk or even in a precancerous stage. So all these patient women can be better managed and put on a close surveillance or whenever needed, and active steps can be taken like hysterectomy. So by pap smear also we can detect cervical cancer in early stage or precancerous stage. Guideline says that it has to be done after the age of 35 years. If we are doing with the human papilloma virus, it can be repeated just after 5 to 7 years. So no frequent repetition of pap smear is needed.
Thank you, Dr. Shah. That was very helpful. So, um, beyond the screening, so prevention is also very important to address the cancer problem. So, what we always wonder what can be the impact of the different, yes. So, prevention is also very important in terms of cancer care and uh, to address the burden of the cancer in our country. So, what can be the impact factors such as our lifestyle, like diet and exercise, may have impact on the cancer uh, the progression to cancer, and also if environmental factor can lead to development of the cancer. What can be done to prevent this to progress?
Right. So diet and lifestyle, it does have a role in as a risk factor or a protecting factor in the development of cancer. So, and there are some other factors also, but first let's talk about the lifestyle. So, I would say that around 50% of cancers are due to some or the other tobacco addiction. So, tobacco is the most hazardous and most dangerous factor, which is important in the development of many cancers. Tobacco in any form, like smoking, in terms of BD or cigarette, or chewing tobacco, both are equally harmful. So, smoking almost is a causative agent for almost all the cancers in our body. The most important being the oral cavity, then laryngeal cancer, esophageal cancer, lung cancer, even colon cancer, kidney cancer, bladder cancer. There are a number of cancer, but most important are this one. And chewing tobacco commonly is associated with the oral cavity or the throat cancers. So basically, it is a very huge number of patients which are tobacco-related cancers in currently in our society also. So these are the addiction-related factors. The third thing is alcohol. It also causes causative agent for a lot of cancers, common being liver cancer, bowel malignancies, even breast cancers. So first of all, this factors, and apart from that, a sedentary lifestyle and being obese. So both of these are also a risk factor for colon cancer. Like obesity is the important risk factor for colon cancer. Even postmenopausal breast cancer uh, is also obesity as a positive risk factor. So these are lifestyle related factors. There are also certain factors which are not avoidable, like family history of cancers. Nowadays, we are finding families with lot of hereditary cancer history. Like one member in the family is having breast cancer, the other is having ovarian cancer, uterine cancer, bowel cancer. There are many genes responsible for that, commonest being BRCA1 and BRCA2, which are linked with the breast and ovarian cancer. But there are other also a number of genes which can be hereditary and can produce different cancers in different family members. Sometimes age and race, like there are certain cancers which are common at certain age group of patients. Some cancers are common in younger age group, like bone tumors. Some cancer always happen in later part of life, say pancreatic cancer, bowel cancer. So they are sometimes age dependent also. So these are unavoidable risk factors.
So, as we are today addressing our employees, so how workplaces can encourage the regular health checkups or any cancer prevention awareness initiatives? If you can throw light on that, what we can do to further increase awareness.
Like I would say, being at workplaces is the best opportunity sometimes to detect cancers at very early stage. As at workplace, there are frequent health checkups are going on, and it is compulsory. I know, so they have to undergo the health health checkups, like blood test being done. Sometimes basic imaging workup is done, and at least they are seeing a doctor after all those investigations. So sometimes a smallest of complaint doesn't get unnoticed, and sometimes on this basic test only there can be some signs of or some doubts of cancer, and those can be worked up on later stage. So I think that is an opportunity.
Right. Thank you so much for this perspective. And now I would like to hand over the session to uh, Mr. Sandeep. So if you can have any question, so we can discuss this.
As of now, sir, there is no such question in chat box. I could not find any question. Sir, anything else, one or two important point where you want to emphasize with a closing note? So, I mean, that can be a key notes and people can remember always.
Yeah. So first, I would like to add that right now, also currently, also there is cancer is a stigma in our society. So being diagnosed with a cancer or taking treatment related to cancer like chemotherapy, radiotherapy इज ए स्टिग्मा. वो ऐसा लगता है कि हम कैंसर पेशेंट है तो हम उसके साथ रह सकते हैं कि नहीं रह सकते हैं, हम उसके साथ खाना खा सकते हैं कि नहीं खा सकते हैं, हमारे बाकी के फैमिली मेंबर को तो उससे कोई खतरा नहीं हुआ है, कैंसर होने का चांस नहीं रहता है. सो वो एक डर है हमारे सोसाइटी में अभी भी. सो आई वुड लाइक टू जस्ट शेयर दैट ऐसा नहीं होता है. कैंसर डजंट स्प्रेड बाय टचिंग, लिविंग टुगेदर और शेयरिंग फूड. तो वो स्टिग्मा नहीं रखना है. सेकेंड थिंग इज देर आर लॉट ऑफ न्यूअर ट्रीटमेंट मोडालिटीज आर अवेलेबल. आई एम बीइंग अ मेडिकल ऑन्कोलॉजिस्ट, हमें कीमोथेरेपी, टारगेटेड थेरेपी, इम्यूनोथेरेपी, ये सब चीज से हम ट्रीट करते हैं. बट पहले खाली कीमोथेरेपी होता था. there was no like targeted therapy, immunotherapy are the newer developments. So and all these new treatment modalities have very less side effects. इसके side effects काफी कम होते हैं, काफी ट्रीटमेंट में बिल्कुल साइड इफेक्ट्स नहीं होते हैं एज कम्पेयर टू द प्रीवियस वेरी टॉक्सिक कीमोथेरेपी रेजिमेंट्स. बट यस, वो भी है कि किसी किसी कंडीशन में ओनली कीमोथेरेपी इज द ओनली थिंग विच वर्क्स. देयर इज नो ओरल ट्रीटमेंट और इम्यूनोथेरेपी, टारगेट थेरेपी वो काम नहीं करता है. सो वी गिव कीमोथेरेपी. हम जो भी कीमोथेरेपी देते हैं वो पेशेंट की एज, उनकी जनरल कंडीशन के हिसाब से देते हैं, सो दैट ही और शी कैन हैव लीस्ट साइड इफेक्ट्स एंड मैक्सिमम बेनिफिट उससे मिले. सो कोई भी आप कैंसर की ट्रीटमेंट के लिए मिल रहा है कैंसर के डॉक्टर से, तो आप ओपनली डिस्कस कीजिए कि इसमें क्या क्या ट्रीटमेंट ऑप्शन हो सकते हैं, व्हाट इज द बेस्ट चांसेस ऑफ क्योर. बट वो ट्रीटमेंट नहीं करना या ऑल्टरनेटिव ट्रीटमेंट में जाना, वो ऑप्शन नहीं है. हमने काफी केसेस में हम देखते हैं कि काफी शुरुआत के स्टेज में होता है कैंसर, बट ड्यू टू लैक ऑफ अवेयरनेस वो ऑल्टरनेटिव ट्रीटमेंट करते हैं. They don't go with the cancer treatment or surgery or radiation, and then it progresses. वो फिर फोर्थ स्टेज में चला जाता है.
And I have one question that the earlier the treatment starts, the better it is. So how true is that for the patients? Can you discuss for our audience?
यस. सो जैसे कोई भी कैंसर अर्ली स्टेज में डिटेक्ट होता है तो फर्स्ट ऑफ ऑल स्टेज स्पेसिफिक सर्वाइवल होता है. जैसे फॉर एग्जांपल आई वुड से अबाउट द ब्रेस्ट कैंसर, so stage 1 patient would have a 90% chances of cure. As we move to stage 2, the chances become somewhere around 75-80%. Stage 3, it becomes 50-60% chances of cure. And fourth stage practically is not curable but with good treatment, we are now prolonging the survival up to 5 years in many a times. So whatever treatment we do, हम कुछ भी treatment करें, but एक stage जो first day पे आपका decide होता है, उसके हिसाब से एक basic survival chances fix रहता है कि इतना around इतना रहता है. The next benefit is कि earlier stage में detect होने से the number of treatment modality becomes less. So पहले भी मैंने बताया कि केवल सर्जरी हो गया, then further treatment may not be needed. जैसे ओरल कैंसर है तो उसमें तो जैसे जैसे स्टेज आगे बढ़ता जाएगा, नंबर ऑफ मोडालिटीज विल बी इंक्रीज्ड. स्टेज 1 और सम स्टेज 2 में ओनली सर्जरी इज रिक्वायर्ड, और ओरल कैंसर उसमें रेडिएशन नहीं लेना है. लेकिन स्टेज 2 या उससे ऊपर गया स्टेज 3 में तो रेडिएशन इज मस्ट, रेडिएशन हैज टू बी टेकन. सो रेडिएशन की खुद के साइड इफेक्ट्स है, बट वी हैव वेटेड फॉर इट टू बिकम स्टेज 3 फ्रॉम स्टेज 1. सो वो अगर हम वेट नहीं करें, हम तुरंत उसका ट्रीटमेंट करवाए, तो केवल सर्जरी से भी ये मिट सकता है. बट जैसे अगर थर्ड स्टेज के आगे या 4A में चला गया, देन कीमोथेरेपी इज आल्सो नीडेड. सो ये ऑल दिस ट्रीटमेंट्स आर नॉट वेरी इजी, आई वुड से, फॉर एटलीस्ट हेड एंड नेक कैंसर पेशेंट्स. बट यस, अर्ली स्टेज में है तो ट्रीटमेंट बिकम्स इजी, लेस मॉर्बिड, रिकवरी फास्ट हो जाता है. ट्रीटमेंट अगर 1.5-2 महीने में खत्म होने वाला है, as compared to the longer treatment, which is 5 to 6 months.
Because Mr. Dipendra Kumar Singh, HOD for Cadila Oncology. So, sir, over to you.
Now my part is, sir, to say thank you very much for giving an enlightening session for Cadila as a group, sir. There are 28 small businesses are there together in under the Cadila. We are representing Cadila Pharmaceuticals, but there are other functions also. So people across India have joined this session, sir. Thank you so much. And as you rightly said, awareness is more important than the curative approach. So prevention is better than cure. So this will help us to people at larger extent. And as a Cadila, we also facilitated the same for the awareness purpose. Thank you very much for joining, sir, and giving us the session. Thank you.
Thank you. There is one question I would like to answer. The question is, nowadays a lot of children are affected by
Yes.
cancer. What factors are involved?
Right.
Yeah, so for very young children, say of age like 1 to 5 years, many blood cancers are common. So इजीली वो क्वेश्चन होता है कि इनमें तो बाकी के जो भी हमने फैक्टर्स डिस्कस किए वो नहीं होते हैं, फिर उनको क्यों कैंसर होता है. सो उनमें काफी जेनेटिक फैक्टर्स इन्वॉल्व रहते हैं, विच आर मोस्ट ऑफ द टाइम अनअवॉइडेबल रिस्क फैक्टर्स, अनलेस की पेरेंट्स में जेनेटिक एब्नॉर्मलिटीज हो जो कि बच्चों में ट्रांसमिट हुई हो. सो बट यस, वो होता है कि उसका भाई या बहन होता है तो ही और शी इज हेल्दी, बट एक ही भाई को जो कैंसर होता है वो ब्लड कैंसर होता है. सो उसमें कुछ कॉजेटिव फैक्टर, नॉन रिस्क फैक्टर नहीं होता है, बट मोस्ट ऑफ द टाइम इट इज जेनेटिकली डिटरमाइंड, एंड वो कैंसर सेल प्रोड्यूस होते हैं. Then comes the bone tumor, which occurs at somewhere around the age of 9 to 15 years of age. So उसमें थियरी ये है कि जब ग्रोइंग बोन्स होते हैं उसमें बहुत रैपिड सेल डिवीजन होता है, बहुत फास्ट ग्रो होता है. सो वो ग्रोथ के टाइम पे कुछ जेनेटिक एब्नॉर्मलिटी हुई जो कि बॉडी ने खुद से फिक्स नहीं की, तो उसमें कैंसर हो सकता है. बट यस, अगेन वो कैंसर भी मोस्ट ऑफ द टाइम वो लाइफस्टाइल रिलेटेड फैक्टर्स या उससे नहीं रिलेटेड है. Those are the unfortunate ones, and this is the only theory that we have.
Right. And I hope if in the children's the cure is faster than the adults age. Right? It is right, sir?
Yes. All this, both of the cancer that I mentioned, the commonest leukemia in children and the bone tumors have very high cure rates. Broadly, I would say that around 75 to 80% of these patients can be cured.
Thank you, sir. Thank you so much. Sandeep, anything?
So, sir, generally what happens, na, there is a say, I'm just one call away. And this is actually proved by you. I just called up you and you said ki I am available and I would be happy to address Kedila. So this is the thing, sir. Thank you very much for taking out time from your busy schedule and enlightening us with your knowledge. And definitely the information which you have shared with us, it will help a lot. And we'll keep doing such awareness program. I think this is the key where we can become fighter and we can fight against this deadly disease, sir. So, sir, thank you very much
My
for
pleasure.
joining and enlightening us with this session, sir. Thank you very much, sir.
Thank you. Thank you.
Thank you, sir.
Thank you, everyone.
Thank you. Thank you, Dr. Shah, for sharing your expertise today.
Yeah. Thank you.